Right, now, chest x-rays and imaging has been at the centre stage during the coronavirus pandemic. Well, Dr. Sam Hare is a consultant radiologist and lead chest radiologist at the Royal Free London NHS Trust. He is heavily involved in the battle against COVID-19, and he's been writing about how the radiology department are coping at the moment. I am so pleased to say Dr. Sam joins us on the line now. Hello, Sam.
Oh, hi, Joe. Thanks for having me on.
Oh, no, I'm really chuffed that you've agreed to do this, because am I right in thinking you're actually working from home?
I'm working from home today. I've come out of self-isolation. I was diagnosed with the virus myself a couple of weeks ago now, so I had to do 7 days at home. At the moment, I'm calling you from home, yeah. But so still able to look at x-rays and still able to look at scans.
Yes. Can we talk a little bit about you didn't self-diagnose. I've been listening to you on a podcast, a fascinating podcast, talking about how you had concerns about your own health, but it wasn't a hacking cough, it wasn't a dry cough. You said it was almost like clearing your throat, so you thought you ought to be tested. Is that right?
That's right, yeah. So as people sort of have been hearing about in the media, lots of people can be asymptomatic, up to about 40%, but some people can just have very vague symptoms, a little bit of a dry throat, a little bit of a cough, and some slight chest soreness. And I had some of these things. I wasn't sure if I was just being anxious, being in the work environment, or whether it was real. And actually, the reason I got tested was my daughter, Annika. She's got severe special needs, and I thought, hang on, I can't only think as a doctor, I've got to think as a father, and, if I get the virus, she's in a high-risk group, so maybe these symptoms are real, maybe they're not, I'll go and get checked out, and surprisingly, I tested positive with very little symptoms.
And this is, when I heard that, it really did worry me, because there are people at the moment, we do loads of phone-ins on hay fever and people who've got colds and coughs or whatever. There are maybe so many symptoms that are being disguised at the moment. Would you agree?
Yeah, I would agree. The reassuring thing is that if you've got vague symptoms, although you may test positive, you may not be one of the patients that ends up in hospital, but it's vital that you do self-isolate, because as we know, this virus can spread very easily, and that's the whole point of stay at home saves lives. It's the asymptomatic people in some ways who are a big threat to the most vulnerable in our society.
Absolutely. So can I ask then, a radiologist then, you are the person that makes diagnoses from using an image. A radiographer is somebody who carries out that x-ray, but it's then given to you and you will diagnose an x-ray. Is that right?
That's right, yeah. So big shout out to radiographers, actually. They've been real heroes in this. So if you think about it, every patient with possible COVID infection comes to your hospital and they have to have an x-ray. And as a doctor, the radiographer will take that x-ray, but as a doctor, that will then get passed to me on an electronic system, and I'll look at that x-ray and be able to say, what's the likelihood of this being COVID infection? And through my work at the British Society of Thoracic Imaging, we've produced national guidance to try and help everybody through this and get us through to the other side. And the way that we've done that is we've developed a simple system for saying, okay, this is classic COVID, could be COVID, and this is not COVID. And that system has helped everybody across the country so much.
So I love the fact you're calling it classic COVID when it's so new, isn't it? I mean, you will never have seen anything like it probably until, or would you have done? I mean, when did you first see classic COVID? Would it have been January?
Yeah, it would have been about later than that, probably about 4 weeks ago. I'm, thinking back now, maybe I saw something that I called, atypical, some sort of weird new infection, but the term classic COVID only came about later through our work with BSTI, and I mentioned that in the PonderMed podcast that you've mentioned.
It's a great podcast, by the way.
Yeah, oh, thanks. And that this classic COVID, literally from a disease that we didn't even know of, that was somewhere in China, just became everywhere in London. Particularly, we've been ahead of the curve, as you know, and the term classic COVID just seems so apt, even though it was like such a ferocious pace that this thing hit us.
So I am fascinated to know what the difference is then, what appears on an x-ray that is a virus, that is not obviously malignant, that is not a cancer, that is not just I don't mean just an infection, but could be an infection. What do you see? Is it a difference in shapes, in colour?
Yeah, I'll describe that. So, there's lots of different divisions of radiology. So I'm a chest radiologist. So this is my area. The lungs are my thing. The lungs are the things of chest radiology. So usually your lungs, healthy lungs, we love seeing those. They're nice and black. They should be black. They should be full of air. A tumor or an infection looks like one spot in the lung. So that might be, the size of a 2p coin, or it might be in one area of the lung. But what hit us and shocked us with these COVID x-rays was the lungs. Both of them are just full of white gunk. And that is basically the virus and all the inflammation and infection around it, the inflammatory response. It just fills the air sacs of the lungs. So the lungs are full of air sacs. That's how we oxygenate and get oxygen to all of our tissues. But if the air sacs are full of gunk, there's literally no oxygen flow happening. And that explains why these so many people are on ventilators, and young people, old people. It's affecting so many people.
Oh my gosh! So you can see the way you explain it. Then definitely, it's different to what looks like an infection on the lung. It's actually the lungs are full of this stuff.
Yeah, it's different to a bog standard infection, which you'd give antibiotics for. This just, you see it, and then you just think. Originally, even though I'm quite an experienced chest radiologist, I just thought, what's going on here? What are we seeing? And then after about 2 weeks, we got into this strange situation where we stopped seeing the tumors and the standard infections. Literally 70 to 75% of all of our x-rays in hospital were this new classic appearance. And so it was easy to come up with that term.
And what can you, this is obviously, but you'd have more knowledge about this than me. How do you clear that gunk? What gets rid of that gunk? Because at the moment there isn't a cure, there isn't an antibiotic that will do it. So what what sort of hoovers out the lungs then?
Yeah, so antibiotics obviously, will only target bacteria. So there's been a lot of research going on at the moment with antiviral drugs, but we haven't come up again at anything. The main thing is just time. So there isn't really a directed treatment here. You need to support these patients, some of whom are frail, elderly, some of whom are my age. I'm 42. And you just need to buy them some time. And the way that you do that is you use either something called a CPAP machine, which pumps in oxygen into your lungs, or a formal ventilator, which basically takes over the function of the lungs and does your breathing for you. And in time, the body should be able to fight back and with its own immunity and fight off the virus. But those first couple of weeks, the virus seems to be swamping the immune response, and that's why so many people have been doing so badly. But thankfully, I think we're seeing the end of the tunnel, because as Boris Johnson rightly said yesterday, definitely in London, we are past the peak of this. A couple of weeks ago, literally even as radiologists, everything we were doing was COVID, every patient was COVID, and I was doing a night shift last Sunday, and I think I only saw two COVID chest x-rays out of about 40.
Mm-hmm. And would you, everyone I know who's had it, or not that I've known or I've spoken to on this radio station who have had it, have said, when they've had it bad, the recovery, they feel like they've been literally knocked for six. Is it because the lungs then have to get really pink and healthy again? You have to, I always think of lungs like bellows, so you have to exercise them so they get back into that healthy muscle. Is that what you're trying to do after you've had it?
Yeah, so the lung will try and clear this infection in time, but it isn't an overnight thing. It takes a lot of time, and that's why so many people have severe fatigue and tiredness for a good 2 to 3 weeks sometimes after having the full-on form of this infection. And what the lung is trying to do over a prolonged period of time is to clear this virus so that it doesn't end up having scarring that can leave long-term damage, and that's what we're still learning about at the moment. And the British Society of Thoracic Imaging is looking at that in particular, like how many people are going to end up with scarring in their lungs, and hopefully not that many, but it's still a work in progress, and we're learning as we go.
Gosh, you're rather like TB then.
Yeah, so but fearfully it could, hopefully not in a much wider area in the lungs, because TB often is usually in 1 or 2 places, whereas this coronavirus is affecting the lungs without leaving any lung untouched, really. It's just everywhere.
You're probably not the person to ask, but you're a medic and you're someone who has worked hard throughout this whole pandemic. And we were saying right at the top of the show, this is a crazy thing for me to say, but suddenly my local supermarket, the butcher's counter has opened, and the fresh fish counter has opened, and the flour stall outside has opened. This is, to me, in my area, they've slightly relaxed some of the rules, and certainly walking in, there's far more people out, there's far more traffic. What would you say as a medic to that? Do you think we shouldn't be too optimistic, that we should just be a bit more cautious at the moment?
Yeah, so what I would say as a medic is, although we've passed the peak, it's very, very important, particularly Londoners, all our listeners in London, you still stay at home, because the last thing we want is to start going out, doing normal things too early, because then we'll be hit with a second wave, which will swamp the NHS. We've done a fantastic job protecting the NHS so far, protecting all our radiographers, protecting all our doctors, nurses. It's time to just stay at home for that little bit longer, see it out, and then we will be in a good place. But don't rush out too early.
Sam, it's really good to talk to you. If people want to follow you on social media, it's at Lung Diagnosis. Is that right?
It's at Lung Diagnosis, and please, I urge you to listen to the PonderMed podcast. And follow
it's so good, yes.
Yeah, the British Society Thoracic Imaging website has great information, not only for medics, but also for lay people. So have a click, have a look, and we'll show you some nice x-rays on there.
Yes, it is fascinating reading. Dr. Sam Hare, thank you so much for joining us on the afternoon show.
Thanks, Joe. It's been brilliant. Thanks for having me.